Okay. The topic will be about the central and peripheral paralysis of the facial nerve, the differentiation, the diagnosis. So I will talk about the anatomical part of the facial nerve. The facial nerve is the seventh cranial nerve, or simply CN number 7. It emerged from the bones in the brain of the brain stem, controls the muscles of the facial expressions and the functions of the connivance to taste a sensation from the anterior two-thirds of the tongue. The facial nerve has its nucleus in the bones. It takes a rather winding route before exiting the skull through the stimulatoid foramen. It passes through the parotid gland, splitting into 5 branches. We have temporal, zygomatic, buccal, and mandibular, and cervical. The facial palsy or paralysis is caused by damage of the facial nerve that supplied the muscles of the face. It can categorize into 2 types, depend on the location of the cause pathology. We have the central facial paralysis, and the second, we have the peripheral facial paralysis. The central facial paralysis due to the damage above the facial nucleus, but the peripheral facial paralysis due to the damage at the below of the facial nucleus. Here we can see the picture of the difference between the central and peripheral damaged neurons for the facial nerve. We can see that in the central part we have it's upper than in the cortex and the neuron before the neuron, and in the peripheral we have it in the after below the neuron. We can see here, and the difference between the expressions that the peripheral damage our neuron, we can see that it's the half or the middle of the face. There is no sensation, there is no expressions. They can't move their frontal muscles and the place of the mandibular and zygomatic, and we have the drop in the lid of the eye and in the mouth also. So this is in the peripheral part, but in the central part we have just in the lower part of the face. So this is the difference. We can categorize them by the forehead. We can see that in the peripheral, it's the half of the forehead. It's not moving. There is no movement in the. You can do the expressions by your forehead muscle, but in the central, it's already still there's movement. So in the central facial paralysis, the central facial paralysis is a symptom or finding categorized by paralysis or paralysis of the lower half of the one side of the face. It usually results from the damage of the upper motor neurons of the facial nerve, and we can observe this by there's signs of it. There is loss of nasal labial fold and the lower lid drop, and ability to close the eyes, and preservation of the forehead, like what I said in the previous picture, in the forehead, and below movement and brow movement. You can do your brows. We can see that. But in the peripheral facial paralysis, we can see that is the diagnosed upon the clinical presentation with the weakness of the facial nerve branches, dropping of the brow, incomplete lid closure, and dropping of the corner of the mouth, and also impaired closure of the mouth, dry eye, impaired taste, or the pain around the ear. So we can know it by there's signs of it. There's loss of nasolabial folds and lower lip drops, inhibitory to closed eyes, and loss of forehead and brow movement. This is the difference between it and the central facial paralysis. So here I'll talk about the differential diagnosis of the central and peripheral facial paralysis. In the central, we can know that there is neurologic. We have Guillain-Barré syndrome and papular paralysis, pseudopapular, and multiple sclerosis, which is disorder in the immune system. We have this is a type of immune disease which is cross the brain blood barrier, and we have the idiopathic and trauma. In the peripheral, we have idiopathic or bell paralysis, spasticity, which is there is no reason. We don't know the reason of the etiology of this disease, and tumors, and we have infections and also autoimmune dysfunction. Thank you.